I want to bring in Dr. Becky Cooper, who wants to ask an additional question in this area.
Yeah, thank you, Chair, and thank you both for coming. So I should declare that I'm a public health consultant, so I have commissioned NHS health checks. So I just wanted to ask your thoughts, really. It's interesting to hear you talk about GPs, and I'm a big fan of GPs, they're fantastic, but when I tried to commission health checks, there were issues around capacity in general practice, and there were issues around how many GPs I could get interested in actually commissioning health checks. And I am a medical doctor myself, and I understand the pressures of primary care. So, whilst I'm all for allowing primary care to be a real heart of a community and family doctors, etc., I have concern that if we put too much onus on primary care, that we may miss out on other opportunities with pharmacies, etc. So just listening to what you're saying, I just wondered if you could respond to that. Thank you.
I mean, obviously it does.
Before you respond, can I apologise, because I should really have brought in Mr. Greg Stafford. Do you want to ask an additional point to that, because that was the area you were asking on, or do you want me to get?
Well, I think I'll let because it's very better if
just so that we're clear. Okay, over to you. Thank you.
Yes, and I think it does come down to the resources and the ability for general practice to undertake this work. And as I've already stated, we have less GPs now. There is a new scheme in place from the Secretary of State around more GPs in general practice. The scheme is quite inflexible. It has issues that we need to deal with, but we need to get more nurses. It's not just about GPs, of course. The whole team is important here: nurses, primary healthcare workers, and social prescribers and others. So it's about boosting up general practice and getting the staff in there. Then we can do more. As Sam said, we are very fleet of foot. We have a very flat management structure. We're the only part of the NHS that doesn't have a deficit. We don't run deficits. We can't do that because if we're bankrupt, we can't hold our contracts. So, that's why general practice absolutely needs to be focused on, invested in, and we'll do more. We do more and more if we're given the opportunity to do so. And it follows on, if you provide the funding and the staffing to do these health checks, more of them will be done and undertaken, and more diseases will be prevented. But it's about getting that staff into the community, and that trusted practice in the community, known by patients, so they're more willing to engage with than perhaps an external provider.
Becky, has he answered your point?
Yeah, absolutely. I'll let Greg carry on.
Brilliant. We'll go straight on to Dr. Becky Cooper.
Quick, I know, yeah.
And thank you for that, Danny.
Very quickly, do you think this should continue to be a universal offer?
So, look, I do think there's a balance in this, that there is advantage of getting as many people as possible. We are not, as a country, a healthy population. As I say, the people who've had a health check, 95% of them have at least one risk factor. 70% of them have a brief intervention to try and improve their behaviour. And then, we're finding 11% of them actually need clinical management. So there is significant risk. So I am keen in how do we find ways for as many members of our population to really understand their risk and to take care for themselves, and so I think that is important. That said, we really must be trying to focus our attentions on reaching those at most need. So we need to try and do both things, which
It's a beautiful political answer, thank you so much. But on balance, would you, if you have a limited pot of money, which you do, would you favour making this as a targeted programme?
Look, I think to answer that question, I'd want to be very clear on what we thought the benefits were and the evidence for those, and maybe Janelle might want to give a public health view at this point.
Yeah, I think it's a good challenge, and one needs to keep on going back to the evidence base. And I suppose there's a trade-off, isn't it, between universal or targeted, and I think that's also something that we will be looking at again. At the moment, it's not clear-cut. And I think the point, and the NAO report shows, figure 6, I think, is a really good figure, which shows that mortality rate, across all deciles. It's 1 in 4 people die from cardiovascular disease. So it's not the case that it isn't in particular communities. We need to reach into all communities, have those conversations about their level of risk and what we can actually do about it. But we also know if we're not reaching into and prioritising energy and effort in those communities who will benefit the most, that's a problem. So I think We need to do both and. One of the issues, and it might come up in subsequent questions, is around that data to understand, well, who exactly are we reaching? And the assumptions about perhaps who we're reaching, who we're not reaching. Local areas will have some of that information, and they may well be already within their universal office targeting in particular ways, so particularly contracting particular community pharmacists in particular communities, for instance, or they might be doing opportunist screening events or contracting community champions or VCSE to work with particular communities. So I think within the programme and the way it's delivered in local areas, I think you'll find that there's a universal offer, but effort also put into in trying to get to those communities who would benefit from it most.
Thank you, which is interesting given our previous GPs who were here who were very much of the opinion that GPs should be delivering the health check, so it's interesting to hear the different perspectives.
We're going to hand swiftly over to Becky to ask a question.
A couple of questions, okay. So I was going to ask about the broader public health agenda, but I'm going to stick with a couple of things because I think it's quite important. So the NHS health check, do you think you've got a branding problem? Because ultimately what you're telling us is that this is CVD screening, albeit you're picking up dementia, etc. Have you considered not calling it a health check? Have you considered calling it a heart disease screen or something? Because I think, and this is, 20 years in the public health business, an NHS health check says nothing to people and it can be easily dismissed. Have you considered that? Have you thought about actually we need to be much more effective in telling people what we're doing here?
So it's not a screening programme.
I know the screening thing is tricky, Janelle, I understand that, but there is something more specific that could be said about what you're doing here.
So just can I check? So is your point about what it's called and then how it speaks to people?
And how it speaks to people. Have you considered there might be a blocker there that health check says nothing, essentially?
I mean, we could look at that communication. It hasn't come out specifically, but it's certainly something worth looking at. But it's more, so in terms of what it's called on the package, as opposed to how it lands with people.
Yeah, and I think just want to add the 2021 review, one of those 6 recommendations was actually that we should think of a broader range of conditions to be in the health check. So I think we've got 2 things here. If it is really about CVD and that's all it will be, could we communicate that better and would that reach more people? Or actually, is the long run, this will become a broader health check, looking at a wider range of risks? And I think that's a big question.
Sure. But the branding I would recommend have a think about. And then the other issue that I just wanted to bring up was about funding. So it's £60 million, is that right?
I have written it down somewhere, it's something of that order. But
fine. I mean, that is...
£62 million.
£62 million. So that's ultimately a drop in the ocean compared to acute care funding, etc., etc.
Sorry, £62 million for the health check.
Yes, absolutely.
So not all of the follow-up that happens after.
Fine. So commissioning of health checks, £62 million. Clearly you believe in this programme, you think that it's worthwhile. There's an NIHR report that says, this is actually doing some good stuff. Do you believe that this should be funded more substantively? Because £62 million clearly is only going to get you so far.
Yeah. Also, clearly it's a local government responsibility, so they make the decisions on theirs. They're provided with £3.6 billion in the public health grant from government to meet their local public health requirements. I think we would like to see greater take-up of the health tech. Yes, I think that, I personally would like that. I think the questions that my minister is asking me after the NEO report are about how do we drive more take-up. So I think,
Okay, so
that's
you
the
think there
work
should
we
be
are
more
doing.
funding allocated to
No,
this?
I definitely think I would like to see have more take-up, and I think we should be looking at how we do that.
Okay.
That work is ongoing.
One more question, around funding about prevention, and perhaps this is for both of you. So prevention obviously has multiple benefits across society, and we could argue primarily that it is in health, but of course it is around economic growth, etc., etc. Do you think prevention funding should primarily come from the Department of Health and Social Care, or do you think that other departments should have a prevention fund?
Janelle will probably do a more technically advanced. Look, I think prevention in that broader sense of how do we have the best possible health for our population really is a cross-government effort. Do we have great housing? Is our education system working? Exactly what of that you would call prevention, I think, is a more difficult challenge. But I do think we are thinking much more through the various missions that this government's adopted about are we spending our money well to drive that. The Opportunities Mission looking particularly at early years and are children ready to learn, which is both a set of education interventions, a set of health ones, so broad. So I think we're starting to do that much more broadly. And I do think within the Department of Health, we are looking at, in the Secretary of State's shift from treatment to prevention, are we prioritising the things the NHS can do itself in secondary prevention and other areas to really prioritise this work and ensure that we're getting the best possible health outcomes for people, and hopefully reducing the cost of the NHS over time.